Welcome back to Break the Line Season 2, coming to you on your behalf of the Boston Public Health Commission, Youth Prevention Program, and Youth Advisory Board.
Hi, I'm John.
I'm Max.
And I'm Zay. On today's episode, we'll center on the access to substances in your community with the help of VPHC, Catrina Cooley, and we'll figure out why there is so much access to substances among teens today and what we can do to limit the access.
I really like this subject because when I'm at school or playing online with friends, I hear my friends talk about themselves using it. I see people at school, people in public, even people on the bus doing vapes and stuff. And a lot of these people are underage, with vapes and things they shouldn't have their hands on, but they do anyway.
This isn't my favorite topic. It does suck to constantly have people vaping and it going in my face and stuff. But I do think limiting access is important, but I'm also worried limiting access, people might try to access it in more unsafe ways.
We mentioned her briefly, but we have a special guest for today's podcast, introducing Catrina Cooley, the Program Manager of Community Affairs in the Office Recovery Services at Boston Public Health Commission. Thank you for coming, Catrina. Can you tell us a little bit about yourself?
Thank you for having me. So my name is Catrina Cooley, once again. I work for the Boston Public Health Commission at the Program of Recovery Services. And I am the Program Manager for Recovery Services of Community Affairs.
What part of Boston do you live in?
Well, presently I live in the Roxbury area. I'm from the south end of Boston.
When did you move to Roxbury?
I moved to Roxbury about 7 years ago.
Okay.
About 7 years ago.
So Catrina, why did you choose this job? What was your motivation?
I started working in community with people directly in the late 80s, right? After I got out of high school, went to college, came back, went to school for be within criminal justice field. And I came back and started working in corrections, and I saw that it was a special need for people to advocate for people who had a hard time advocating for themselves, right? And I knew that eventually those folks that were incarcerated would be going back to the community. And one of the things I saw is that it was the fact that the recidivism rate, right? People kept returning back for the same reason. So I put that kind of hat of wanting to be a lawyer, right? Put it down. And then I just decided, I said, you know what? I want to work directly in the community. I want to be the voice, and I want to speak for people who really can't and don't speak for themselves. So I started working in the community around, I started in HIV and AIDS, and then came on and I started working over here at the commission.
So why do you think there's so much more access to substances today?
Well, if you're talking about within our communities of color, because I primarily, and this is where I work in the city of Boston, directly in the city of Boston. I work in the hood, right? And when I say the hood, I say the neighborhood. We call Roxbury, where I work, I do a lot of work in Roxbury, Dorchester, Mattapan. That's the neighborhood, right? And the neighborhood consists of folks that have challenging needs. And one of the needs that they are challenged with is peer pressure, right? When you're talking about young adults, it starts off with peer pressure. It could be coming from the homes. It could be education. And poverty is something that is also looked at within our communities and challenging while we're facing this episode of why kids have access or young adults have access to drugs.
So Catrina, what role do you think friends, family, and local businesses play in the access that teens have substances? Do you think there's any?
I think that there is a role. I think that store owners play a role. And I was talking about this the other day. If there are store owners that are in the community that are coming into the communities, and they are selling different things that young adults like a smoke shop, right? I think they should, if they're playing a role, they need to like follow the guidelines. And one of the guidelines is that you don't sell vapes to a certain age, right? And they need to follow those guidelines that were distributed to them, and these are the rules, you know. But sometimes they don't follow those rules. And I think that parents have a role to play in this too as well. And I think that parents should be obligated to either, if they see that there's a problem down the line coming for their children or their household, maybe get some information, right? Because there's nothing worse than a child coming home, having a rough day, being peer pressured by his friends or her friends, and really wanting to talk to the parent about it, but they know that the parent doesn't have the education to give back to them, so they just call it a loss as soon as they come in the house. And then they go back outside, and then they have to deal with the peer pressure again, and they give in. I hope that answered a bit of your question.
Yes, it did.
In households where substance use is normalized, like in my household, almost every one of my family members, you know, smokes pot, and then when I started taking edibles, they didn't really blink an eye.
Great question, Max. So I want to, without getting this topic a little out of order, because I think it's a great question. When I think about anything being normal, especially around substances, I think about substance use and misuse, right? Mm-hmm. And I think that a lot of times, if people are in a household and they're using, right? Mm-hmm. If they're using, you said your family uses pot. Now, if people were getting out of control using pot, and you were sitting up here and asking the question, like maybe if someone was smoking pot and wanted to jump out the window every time they smoke pot, right?
Yeah.
So somewhere around that would probably be somebody's misusing it, right, in the house. And I can see it being normal. If everyone's doing it, it's like if everyone in the house eats meat, right?
Yeah.
It's normal.
Yeah.
But is it okay or is it not okay? Is that the question that you're asking?
Kind of. Like, what is your opinion?
My opinion is, you know, it's hard. I can't really judge what happens in your household, right? Until there's someone being hurt behind it, right? Because someone might have an element that they might be using the cannabis for, right? Yeah. And is it? I can't judge it, so I'm not really sure how to answer that question right now. But when it gets to the point of someone or the group in your household really misusing it, I think that we need to look at the fact that there's something called harm reduction, right? And harm reduction comes into play where if someone in your family member or someone in your team would need some help around purchasing the marijuana, like if that person, you guys were going out into the street all the time, buying the marijuana from some plugs that you didn't know, maybe that we could start looking at harm reduction in that area, right? And decreasing the harm that might come in that area of buying something that might not be credible, and when you get it home, someone might get hurt behind it. So I'm not really sure how to answer the normalized question, and I think it's how your family thinks, you know, and if it's not creating a bad vibe in your home, I think that it might be normalized. And is it good? I can't tell you what's good for your family. You know, you're there, you could probably use your discretion. And I know that there are many awareness campaigns that are out, that if someone in your family or anyone's family that wanted to know an answer as such, maybe you can utilize those numbers and from a campaign. Yeah.
Okay, thank you very much.
Thank you for just opening it up and just speaking from a personal spot and safe point from your household. Thank you.
You're welcome. I want to talk about about the recent YRBS data for context for those who haven't heard of it. YRBS stands for Youth Risk Behavior Surveillance, whose job it is to help monitor adolescent health, behavior changes over time, identifying emerging issues and plan and evaluate programs to support the health of youth.
So going over both the 2021 and the 2023 YRBS data, we noticed that not much really changed from 2021 to 2023, but there are a few big key changes that were noted across either their segments or across the whole thing. Two of them being tobacco use of cigarettes and cigars and cigarios. For cigarettes, the use doubled from 2021. Well, a little under doubled, and for cigars, cigarios, all that, it just under tripled. But across the entire substance use section, we also noticed that while the changes were slight in some places, it seems to be moving slowly away from most people starting before the age of 15 to 15 or older, which is a positive change. Other than that, mostly everything changed by maybe 1% or stayed the same.
Also, in 2019, 12% of high school students self-reported using vaping products in the past month. In 2021 and 2023, the statistics are both 10%. It seems unlikely that the statistics would almost be exactly the same, given that the tobacco use data that John just mentioned. I mean, we were coming out of a global pandemic and we saw the increase we did in tobacco use. It's concerning that we wouldn't also see a similar trend in vaping. Personally, at school, I've seen like a huge increase of people vaping literally everywhere.
What do you think about the YRBS data? Like how vaping percentages, as Max talked about and mentioned, stayed the same between 2021 and 2023, but like we obviously see like so much more in our community than we did like maybe 2-3 years ago.
Well, that's a great question, John. I was probably thinking to say that we could focus on who's being surveyed. Did they survey the same folks in school? I'm not really sure what BPS did. I'm not really sure how they delivered it. They could have went back to the same folks, and the same folks could have came back and said, this is what we wrote down probably the last time when they just gave the same information. But I think that if we start taking a look at different types of schools, because now you have Boston is it's cut up with match schools. It's cut up with I should say charter schools, right? And different types of schools. And there's different activities. There's probably the same activities happening, but maybe we need to start looking at interviewing different folks from different schools. That's one way. And I think it's important to know like how they're gathering the information, right? We already talked about who, but like what part of the morning are they getting it? Are they getting it in the morning? They're getting it in the afternoon? Are they getting it when the kids are ready to go? Are they getting it from the same kids? And when they're ready to leave out the door, they're ready to leave out the door, right? So I mean, there's a lot that plays in it. But I think one of the folks that really get the good information is Boston Public School System in the department, and to find out how they did gather and who was the respondents to the questions.
How do you think the city can limit access to substances? Like, what about the role of community, friends, families, and businesses?
That's a good question, especially since I work for the city, right? So is that dangerous for me to answer or not? So I think one of the things is I think the surveys are great, right? I think the campaigns are great. We have something that just went up and about smoking right in the bus stations and the bus where you sit in the bus stops, right? I think that it's I'm gonna always go with education. I'm gonna always go with the billboards. I'm gonna always go with teaching young kids early, because if you can get them early, right, you can get some good information in their head where they're like, when they reach that point where there's a lot of peer pressure, they can utilize some options. And I want to also say that I was thinking about like the group of folks that we get that are reached to draw up some great campaigns, right? In the different schools, like our school departments, our schools are divided into this group of this clique over this side. You know, that might be the cool clique. That might be the clique that got the good weed, the green, the kush, the whatever, right? This side might be the kids that study all the time and don't want to be bothered with those folks. But I think it's important to not to just get to the people that are in this clique, but really get to all the cliques, right? And get everybody to pay homage to something which is so great, and is getting the campaign, the information out into the city. So everyone can have a part of empowering their groups, right? In a different way, but really doing some empowerment and reaching the folks that they need to reach. Because the folks that are sitting on this side of the room that are really studying, and they understand their group of folks. So why not let them design something that makes sense for their community? Why not let the people over there waiting for the bell to ring, and they got the good cushion, they're sitting over there probably looking high as, I don't want to say it on TV or on Spotify, but just really, you know, feeling good about themselves, you know, but giving everybody a shot at pouring into the community. So I don't know, I'm looking at campaigns just really meeting the eye of the community and not putting something up in the train stations that make smoking look like a bad thing, like an ugly thing. That, because we found out that those campaigns don't work. You know, we have to meet the community where they're at. So
You saying that stuff about the smoking, that reminds me of that one commercial where the guy had to like peel off his skin to pay for the cigarettes. I don't know if you remember that, but like the fear tactics that they used, it was not.
yeah,
I don't know why they thought that would have worked.
yeah. It's been found that the fear tactics don't work in certain communities.
Yeah, I feel like when a lot of people say like, oh, all drugs are equally bad and you're gonna go to hell when you use them, or like something like that, like, and then someone might try weed and be like, wait a second, this isn't that bad. And they're like, okay, so they were lying about the other drugs too, and then I feel like it could be like so yeah, I don't feel.
And it's also saying all drugs are bad. It's like, there's medicine, those are drugs, like prescribed medicine. Like those aren't like usually what people think of when you mention drugs, but like they are.
Yeah.
And once again, I just push, I'm a harm reductionist. I push harm reduction. And like anything, if you're going to use anything, you need to know what you're using.
Yeah.
You know, you need to understand that product. You need to know. And I think it's very clear that we need to be able to have pillars in the community. If you have smoke stores in your community, like, it's okay to go in and talk to those folks. Like, ask them their intentions. Like, why are they, like, in the community? Build up rapport with them in a way where, like, if you have a great campaign that you want to put up, and probably let them know about the campaign, you know, because maybe it might click in that, oh man, I've been selling vapes to somebody under 21 or 18, whatever the age is, right? They might get that. They might say, oh, we might not, we're not supposed to be doing that, right? Don't hesitate in getting information from the store owners, from the community.
It's actually really great that you mentioned harm reduction, because I was wondering, instead of limiting access, do you think we should offer safer access to reduce harm?
Great question. Another great question. I want to really make it really clear that I'm not endorsing that it's okay for kids, young people under 21, to utilize drugs or vape, by no means. But what I am endorsing is the fact that people who are should have access to help, and depending on what that help looks like for that individual, I think that I would probably pitch something for that around education. But I need to say that around harm reduction, I am standing and sitting here and talking to you, and I really, my everyday work endorses folks, especially over 21, to have options around harm reduction and have the tool bag ready for them. For the young kids, I don't suggest that any type of smoking is great, is good for the body, right? But I am suggesting that there's awareness and it's put up in our communities so young folks could see it, so young folks could understand what it means and what happens if they did that and what the consequences could be around it. And I just think that we need to make sure that we have other options for young adults.
This has been an amazing discussion. We got a lot of questions answered, and Catrina, you've been amazing.
Thank you.
But to my fellow YAB members, what as teens do you think we can do to decrease the access to substances?
I think teens can try to educate themselves about the risk of using substances and have more conversations with each other about them, like we're doing now.
I think that teens should, one, when they are with each other and they're talking, they need to accept who they are, right? And sometimes we try to, I can't say we because I haven't been a teen in years, but I know that teens try to like be different at times. And sometimes it's okay to just accept who you are, know the space that you're in, feel safe in the space that you're in, so you can elaborate and have the conversations that probably make sense and your peers would listen to. And also, if you see something, say something. If something doesn't look right, be able to say it. You know, if you know that what somebody's smoking or what they're doing in some of their habits around their smoking, if it's not, you know, if it's not good for them, if you see something, feel free to say something, especially in your space. Yeah, feel free to say something and own your space. Own your space. So that's all I have for today. And you know, good luck with your campaigns, your work, and making sure that you have a voice and continue to have that voice that can be utilized in our communities to make a healthier community. Thank you for allowing me to be on your show.
No, this really was a great conversation, but that is all for today. If you enjoyed this episode, then go ahead and check out Season 1 and the other episodes of Season 2. A very big thank you to Catrina Cooley for joining us today. It was really great to have your input and be able to talk to you. For our listeners, if you or anyone you know is interested in learning about coping strategies or more facts about vaping or cannabis, check out the website, CopeCodeClub.com. You can also follow us on Instagram at CopeCode Club. Thank you all for listening and have a great day.
Thank you.
Bye.